I consider it such a privilege to work at CPHA and in some small way to be part of the public health community. I really think public health is just so special and that its impact can't be overstated. Ce qui fait que le domaine de la santé publique est tellement unique, c'est qu'il examine la santé d'une si large perspective, la santé de l'individu, de la communauté, en fait du monde. Tout cela est soutenu par un sens profond de justice sociale. And you know, CPHA really has been so pivotal in the evolution of public health, not just in Canada, but globally. But as with any organization, you know, its success as an organization really rests with its people. And we have some remarkable volunteers, members, staff, and partners who really have contributed to this great achievement over the last 100 years. We are just so pleased to be able to use our centenary to celebrate not only 100 years of public health, but beyond that, and to really celebrate the people because they're the ones that make it happen.
This 100-year celebration that we're going into has given us an opportunity to take stock of our strengths, our rich history, the legacy that many public health leaders have shown us in Canada and globally, and put it into context with our current situation and hopefully try to shape our future. I think we're living at a very exciting time in terms of where public health is going. We have a rich legacy to draw upon, but there's also an awful lot of new information and knowledge coming out around effective means of intervention. And increasingly, public health is having a strong role to play in terms of advising, interfacing, collaborating with various sectors within the population that really have a chance to make a huge difference in improving the health of our population.
Ben, je dirais que l'Association canadienne de santé publique a joué un rôle important dans l'évolution de la santé publique au Canada. Et je me réjouis qu'à l'occasion du centenaire, on s'intéresse à l'histoire de la santé publique et qu'on ait des activités telles que celles qu'on a présentement et d'autres pour mettre de l'avant toutes les réalisations de la santé publique au Canada depuis une centaine d'années.
Today I would add simply that I think it's marvelous that the Canadian Public Health Association is celebrating 100 years of existence. It gives all of us who have had the privilege to work in the area of public health in Canada, one of the greatest countries on earth, to reflect on how far we've come, to reflect on how far we have to go, and to renew our commitment to public health in Canada. Thank you.
I would like to wish the Canadian Public Health Association a successful centennial celebration in 2010. I would like to wish all Canadian public health workers success and satisfaction in the work that they do. And I would like to wish Canadian people good health and good sense in behaving sensibly in the future.
Je m'en voudrais de rater l'occasion de féliciter l'Association canadienne de santé publique pour son fantastique 100e anniversaire. Je peux témoigner de ce que l'association nous a soutenus grandement dans la réalisation de beaucoup des tâches les plus délicates que nous ayons eu à réaliser dans le courant de notre vie. Et je pense que la formidable expansion qu'a connue l'association, surtout sous le leadership de Gerald Dafoe, est une manière d'attester de l'importance pour une institution de cette nature-là dans une société démocratique.
I feel strongly that we were fortunate to establish the Canadian Public Health Association as the voice for public health in Canada. Through many programs, agendas, and strategies that we had the privilege to be involved in, such as the HIV and AIDS strategy for Canada, health promotion strategy, the Ottawa Charter, all of these pieces of work that were done by the association really did put us in a position to be the voice for public health in Canada. But even more important is the international role we played in establishing a CPHA as a voice for public health internationally. And I would just think of one example why I feel so strongly about that, and that was the recognition by the World Health Organization of the CPHA in awarding us the Sasakawa Award. The Sasakawa Award was never given to a NGO in an industrialized country, and it's a 4-year major contribution to primary health care internationally. And the underlying value of that award for me, at any rate, was the fact that you had to have the endorsement of all your provincial ministers of health and territories, as well as the federal minister of health to the World Health Organization to even be considered for the Sasakawa Award. So I feel strongly that our role in Canada really did establish the voice for public health, and we had a major part to play in that. And internationally, our development of programs in some 40-50 countries in immunization and in AIDS and capacity building and program development was recognized by the leading body in the World Health Organization, with this outstanding award. So I guess that's probably where I feel the strongest about our achievements.
Celebrating public health, the Canadian Public Health Association, it's 100 years, it's quite remarkable. It's one of the most long-standing, I think, health associations in Canada, and certainly in public health internationally. And I think we should not be typically Canadian about this. I think we should walk with a swagger, we should boast, we should do everything we can to make not just Canadians, but the world aware of the marvelous things that this association has been involved with, have been accomplished. If we look at the Ottawa Charter, it's just one of its kind of stellar examples. CPHA, its leadership was fundamental there.
Moi, je pense que l'Association canadienne de santé publique a été une voix importante qui a aidé à façonner les politiques. Et je lui en suis reconnaissant. Et je dirais que c'est une voix importante qui doit continuer au Canada. Cette voix associative qui aussi ramasse ensemble les provinces avec leur diversité, leurs ambitions. Et ça, c'est synonyme d'un dynamisme important.
I think I'd like to take this opportunity, since this is under the auspices of CPHA, to really point out what an important partner they've been for governments and all the things that have been achieved in public health. I know that in my time in health and welfare, in all of the jobs I had there, I relied so much on CPHA. They were able to do things we couldn't do. I'm thinking, for example, of when we were introducing HIV/AIDS education. In those days, ministers of health and even deputy ministers of health could not go on television and talk about condoms, but CPHA could and did with our support.